Hello, everyone. Good evening for all of you. Just 2 minutes, then I'll start. Okay, please check the voice. Firstly, confirm if the voice is good with all of you. Please confirm.
Yes, sir. Voice is clear.
Thank you.
All is good.
Thank you. Okay, let's start now. Hello, everyone. Good evening for all of you. Today, we'll start our journey about the KAPS exam, the revision for the KAPS exam, the coming one. Firstly, I would like to thank you so much for your attendance in this free lecture. Let me firstly introduce the procedure and the schedule of this revision. We will have 5 revision sessions every week at the same time. Also, we will have the full revision, which will start tomorrow. For each revision we will discuss different types of questions of the previous exams, the previous KAPS exam. Okay, we will discuss the question, we will discuss the rationale of the answer, and if the question changed to another statement or another question, but the same idea, how can we solve this? So it's not only showing the question, but explanation and discussion with the topics related to the question, so that if you have any question or any new question in your exam, you can deal with it by an easy way. We will discuss different topics related to the KAPS exam. All the topics present in paper 1, paper 2, and all the topics. Okay. Before we start, let me tell you what is the content of the 2 papers, each paper. Paper 1, the main composition is pharmacology, physiology, and chemistry. While paper 2, the main composition is pharmaceutics and therapeutics. You should pass 50% of each topic related to the exam. So there is no non-important topic. All of them are important. So we will cover all of them. Okay. I will make all of you mute. And at any time, if you want to ask, please raise your hand and open your mic and ask. Okay. Let's start with the first question and see how can we go with the questions. The first question here, connective tissue that connects bone to bone. Here it is a question related to the anatomy, and mostly this type of questions present in paper 1. So here he asked about the name of the connective tissue that connect bone to bone. We have 2 types here. One of them connecting bone to muscles and one connecting bone to bone. Here the answer is ligament. Sorry. The answer is ligament. Ligament will connect bone to bone, while tendons will connect bones to muscles. Okay? Let us see the next question. The structure of Zwitterion. One of the questions repeated many times previously in the last exams. What is the Zwitterion first? Zwitterion is the ion that contain 2 charges. One of them is positive and the other is negative. And this compound present in the amino acids as an example of the Zwitterion. So the answer here will be C, number C. As you see here, it contains 2 charges. So this is this Zwitterion. In which medium it is present? Does it present in all media? No. It present in neutral medium. It is present in the neutral medium. And this is the structure of amino acid. Okay. Amino acid in acidic medium. In which charge it is present? This will be in the acidic medium. Okay. Carry positive charge. While in alkaline medium, it will carry the negative charge. Okay, this will be the charges that present in the amino acids. And the Zwitterion, it is called Zwitterion when it carry both charges, positive and negative charge. Let us see the next question. Which is not pyrimidine? What is pyrimidine? Pyrimidine structure is the following. It is 6-membered heterocyclic ring containing 2 nitrogens. Okay? This is the pyrimidine ring. It is one of the bases of DNA and RNA. Okay? We have 5 bases: adenine, uracil, thymine, cytosine, and guanine. 2 of them are purine ring, while 3 of them contains pyrimidine ring. This adenine is a purine ring. Guanine is a purine ring, while uracil, thymine, cytosine, all of them are pyrimidine ring. Okay? Generally, the complementary base will be as follows. Adenine will join in the complementary strand with either thymine or uracil. Thymine when the complementary strand will be DNA, while uracil when the complementary strand will be RNA, while guanine combined to cytosine. Okay? Another thing related to the drugs containing purine and pyrimidine ring. Another general side effect. When you know that the drug containing purine or pyrimidine ring, you can expect one of the side effects, which is bone marrow depression. Any of the bone marrow depression complications, either agranulocytosis, aplastic anemia, thrombocytopenia, neutropenia, any of those may present in the side effects of the drugs containing purine or pyrimidine ring. If you revise all drugs containing this ring, you can find this side effect. So this will help you to remember one of the side effects by an easy way. Let us see another question. Which substance listed below that may not enhance the toxic effect of methotrexate? Methotrexate, one of the drugs that considered as immunosuppressant agents, can be used in many indications like rheumatoid arthritis, like psoriasis. Also can be considered as one of the chemotherapeutic agents in many types of cancer. Okay, also in organ transplantation, we can use this drug. So this methotrexate, one of the very important side effects of it is the effect on folic acid. It will destroy folic acid. Okay, so we should not use it with other drugs that decrease folic acid level. Also, we should not use it with drugs that have an immunosuppressant efficacy at the same time. So all of those will enhance the toxic effect of methotrexate except one, which is ethanol. Ethanol here will not enhance this toxic side effect. This is also one of the previous exam questions. Let us see this one. First generation antipsychotic primary mechanism of action. Mechanism of action of antipsychotics, we have two types of antipsychotics. First generation and second generation. Okay. The first generation mostly acting on dopaminergic receptor, while the second generation mostly acting on serotonergic receptor. Okay, so here the primary action of first generation is inhibiting dopaminergic receptor in the brain, so that decreasing dopamine level and controlling the symptoms of psychosis. Okay. Okay.
Yes, sir. Okay.
The next one. The compound shown below inhibit which of the following enzyme? Here we have a structure. This structure formed of a ring. What is this ring? This ring,
Purine.
it's not actual purine, but it is same like purine. Purine ring have a difference than that. Let us see the purine ring.
Xanthine.
Yes, this is the xanthine. This is the purine ring. Okay, this is the purine ring. So here, the nitrogen, each two nitrogens adjacent to each other. Here we have a separation between nitrogen by one carbon atom. So this compound have similar structure to purine, therefore it will inhibit a certain enzyme having the same structure or related structure, which is xanthine oxidase enzyme. This structure for allopyrinol. Okay, this structure for allopyrinol. And it will inhibit the xanthine oxidase enzyme from doing its action. Fluoxetine does not need withdrawal because we explained this previously in our lectures. Fluoxetine is one of the SSRIs. Okay. The difference between fluoxetine and other SSRIs, it have a long duration of action. This long duration of action making this drug eliminated from the body by long time or after long time. Okay, so it will take a time for complete elimination. So it will not cause the withdrawal syndrome. Okay, so the fluoxetine here does not causing withdrawal syndrome because it has a long half-life. Its half-life is about 5 weeks. Its half-life is about 5 weeks. Okay. The next question. The antibody that capable for crossing placenta. Here, the question of the antibody is common in the exam. So let us see some important notes regarding to all antibodies in order to answer any question regarding to this point. I'll put 9 points. Okay, 9 points regarding to the antibodies, the characters of them. The antibody present in external body fluids, like saliva, like tears. It is the immunoglobulin A. Okay. The antibody present in hypersensitivity reaction or responsible for hypersensitivity reaction. It is E. The antibody that present in all body fluids, it is G. Okay. The most common antibody, it is G. The antibody responsible for adaptive immunity, it is G. The antibody that can cross the placenta, it is G. Okay. Also, if it is crossing placenta, it is responsible for neonatal immunity. So the question coming either this or this. which antibody can cross the placenta, or which antibody responsible for the neonatal immunity. It is also G. So here we can add for neonatal immunity. It is G. The antibody which is most potent, take care here. Most common, it is G, while most potent, it is M. Okay? Another one. The first antibody secreted, it is M. The first antibody secreted, it is M. Therefore, it is responsible for innate immunity. Okay. Also, you can add which is responsible for the memory immunity. It is G. Okay. By those points, you can answer any question regarding to the antibodies. Do you have any question regarding to this point?
No, sir.
Yes, please. Let us see this one. For the first order kinetics, the half-life of the drug, does it increase as the dose increase, or decrease as the dose increase, or decrease as the dose decrease, or remain constant at any dose change? Okay, here let us see the first kinetics, what this means regarding to the half-life and other parameters of the pharmacokinetics. If we plot a curve with the relation between the dose and the concentration in the plot. For the first kinetics, as the dose increase, the concentration will increase in a linear relationship. Okay, as the dose increase, the concentration will increase in a linear relationship. This is for the first kinetics, first order kinetics. This does not affect the pharmacokinetics parameters. So all pharmacokinetics parameters in the first order kinetics will be constant. Will be constant. One of the pharmacokinetic parameters is the T-half. So T-half here is a constant, does not affect it. Okay, and for most of the drugs, you see a defined T-half. But with some specific drugs, the T-half changes with the dose. Okay, so for most of the drugs, you'll find a defined T-half. For example, for digoxin, we have a specific T-half, 30 to 40 hours. And previously, we described the fluoxetine. It have a fixed T-half, about 5 weeks. Most of the drugs like this. While for a drug like phenytoin, phenytoin, does we have, or heparin, does we have a specific T-half for it? No. There is no specific T-half. This is due to its kinetic, its order in the kinetic. They are follow zero order kinetics. Okay, so for first order kinetics, the T-half is constant. It does not affect by the dose. Does it increase or decrease? The next question. Which drug against nausea is not used in pregnancy? This is one of the famous and common questions repeated previously many times. How can we solve a question like this? Let us see. Pyridoxine, diphenhydramine, metoclopramide, or prochlorperazine. The right answer here is prochlorperazine. It is not used in pregnancy. It is antipsychotic agents. However, it is antiemetic drugs, but have some serious side effects, such as extrapyramidal symptoms, neuroleptic malignant syndrome, and low blood pressure. It is classified in pregnancy as category C by the FDA, which means that animal studies have shown adverse effect on the fetus, but there are no adequate as well controlled studies in human. Okay, while others can be taken for pregnant women. Yes, please.
Yes, sir. I wanted to ask that is metoclopramide safe in all trimesters or in
Yes,
any specific one?
metoclopramide also should be avoided as much as you can. But in comparison to prochlorperazine, if we have a comparison between both, so this one is not approved.
Okay, thank you.
Okay, so here we have a comparison between two difficult drugs, metoclopramide and prochlorperazine. For sure, pyridoxine is safe. Diphenhydramine also safe, but metoclopramide have some complications, but not like prochlorperazine, which is a direct dopamine antagonist. The next one. All the following are enzyme inducers except. The questions of inducers and inhibitors are very important. Those questions repeated every exam. You should know the list of inducers, the list of inhibitors, and the list of substrates with the cytochrome type. Okay, so there are many tables collecting substrates, inducers, and inhibitors for the enzymes. You should know this list very well with the type of cytochrome. Okay, let me summarize some of them to be more easy. Yes. Okay, let me summarize some of them to be more easier in saving in your memory. All.
Excuse me, sir.
Yes, please.
Could you please send the list of substrates, inducer, and inhibitor?
Do you know the effect of, or what is the meaning of substrate or inducer and inhibitor?
No, list, very important.
The list is present
Yes.
in our lectures. I provided them in our lectures. Also, I will give some summary of them. Okay.
Okay.
All anti-epileptics. All anti-epileptics are inducers except what?
Valproic
Valproic
acid.
Yes.
Valproic acid.
Except valproic acid. So that here, any anti-epileptic agent, you can consider it as inducer. But if the drug is valproic acid, it is inhibitor. So when you find a combination between any drug, drug A, for example, plus anti-epileptic drug, except valproic acid, what is the effect on the drug A?
Increase the metabolism.
Increase the metabolism or decrease the metabolism? Yes, inducer, increase the metabolism. So the level of drug A will be decrease. The level of drug A will be decreased. Okay? Inducer with D will decrease with D, decrease the level. Okay, to remember this by an easy way. Inducer with D, decrease what? Decrease the level. Take care, because sometimes he will ask about the metabolism or the clearance. It will decrease the level, but increase the metabolism and increase the clearance. Okay, while the inhibitor will increase the level and decrease the metabolism and decrease the clearance. From this list, carbamazepine is anti-epileptic, phenytoin, anti-epileptic, phenobarbital, anti-epileptic. So they are, all of them are inducers. Okay. Tobacco smoking. Smoking is an inducer to which cytochrome?
1A2.
1A2. Also, you should remember this. Many questions in the previous exam asked about this point. Therefore, the remaining one would be clarithromycin, which is inhibitor. Okay. All antibiotics are inhibitors except one.
Rifampicin.
No,
Rifampicin.
not ciprofloxacin. It is rifampicin. Ciprofloxacin is an inhibitor. Okay, so all antibiotics are inhibitors except rifampicin. So those two statements will help you to remember the list. Okay, plus adding some other common drugs and common herbal products. For example, the St. John's wort, it is inducer. Grapefruit, it is inhibitor. Okay, so this will help you to remember the list. Let's see the next question. This is one of the calculations. Yes, please. Before we start this. Yes, please.
What is substrate about it?
Substrate means the drug that metabolized by certain enzyme. For example, as we mentioned, codeine is substrate to which cytochrome?
2D6.
2D6. This means that the codeine will be metabolized by this type of cytochrome, and any inducer or inhibitor for this cytochrome will affect the codeine metabolism. Okay, this is the meaning of the substrate. One of the calculation questions. The calculation will be present in the paper number 2. A good news for all of you. For calculation especially, you will not find a complicated calculation problems in your exam because they know that the calculation should be solved within 1 or maximum 1.5 minutes in your exam. So they will not put a complicated questions. The problem here is how to solve the question with an easy way. This is the problem that facing all of us. Okay, so we should know the way for solving the questions by an easy and fast way. And be sure that the exam will not contain a complicated calculation problems. Any question in the exam will be solved within 1 or 2, maximum 2 steps. So let us see this one. If the drug infusion rate is 750 milligram every 6 hours, means that it will be given 4 times per day. Okay, and clearance rate is 8.3 liter per hour. What is the steady state concentration? Here, it is one of the pharmacokinetic problems. For pharmacokinetic problems, we have to do 2 things. The first thing, knowing the formula that we will use. The second thing is adjustment of the units. All units should be similar. You should not use different units. Okay? So, here, what are the information that we have? First one is the rate of infusion, which is 750 milligrams every 6 hours. The clearance rate is total clearance 8.3 liter per hour. And he needs CSS. What is the relation or what is the formula? Before that, what is the unit of CSS needed? Here you'll find in the choices, most of them milligram per liter, except this one. So we will calculate it as a milligram per liter and see the answer. What is the formula? Yes. CSS equal rate of infusion over total clearance. Can we divide 750 over 8.3 directly? The answer is no. No, absolutely no. Why? Because there is a difference in the units. This unit, the time unit, while the weight unit, milligram and milligram, so there is no problem. The volume unit, liter and liter, there is no problem. But the time unit here is different. So we should make the R per hour, not per 6 hours. Okay? How can we do that? 750 every 6 hours. So how many every hour? Just divide 760 or 750 over 6. 750 over 6. It will be 125 milligram per hour. Now we have the ability to divide 125 over 8.3 to get the answer directly, which will be 15.06 milligram per liter. Okay, is it clear? You should do this way in every pharmacokinetic problems. Knowing the formula, this is the first step. The second step is adjusting the units. After that, you can solve any question by an easy way, only one step. Let us see this one, which is common also by this statement or another statement in the previous exams. Let us understand the concept here. A patient with chronic kidney disease receives gentamicin every 12 hours. What is the correct? Firstly, what is the gentamicin? It is one of the amino glycosides, which have a very common side effect, which is
Nephrotoxicity
or affecting the kidney. So the patient having kidney failure or renal impairment should not receive this drug. But sometimes we need this drug. There is no other choices. So what will we do for the patient having renal impairment or kidney problem and need to take one of the aminoglycosides? Here, the dose should be adjusted. How? By increasing the interval. What is the mean of increasing the interval? Instead of giving the drug every 12 hours, means 2 times per day, you can expand this time to be every 24 hours. In this case, the exposure to the aminoglycosides will be decreased. The kidney will expose to aminoglycosides only once time daily. And this also helps us to decrease the dose. How? Suppose that the dose is 100 milligram every 12 hours. This means that the patient will receive totally 200 milligrams per day. Right? When we increase the interval to be 100 milligrams every 24 hours, then the total daily dose will be 100 milligram per day. Here we have two things. Increasing the interval and in the same time, you decrease the dose, the total daily dose. Therefore, here we decrease the effect of aminoglycoside on the kidney. The right answer of this question is number D. So this is the concept. Whatever the statement of the question, this question coming with different statements in previous exams. So the concept here is increasing the interval. So try to find the answer that shows
Doctor,
this. Yes, please.
why are we not choosing decreased dose of gentamicin.
If you decrease the dose, but give the dose every 12 hours, still you expose the kidney to the aminoglycoside twice daily. So it is not the option. The right one is
Okay.
decreasing the exposure to the aminoglycoside. How? By making the dose once daily, not twice daily. And in this case, it will collect both. It collecting the decreasing of the dose, as you see here, we decrease the dose by half, just by increasing the interval.
Excuse me, sir.
Yes, please.
Sir, is that also streaming on YouTube?
Yes.
Okay, sir. Thank you.
The conversion of nucleoside to nucleotide is achieved by the addition of. Let us see the difference between nucleoside and nucleotide. The meaning of nucleoside is the base plus sugar. This is the nucleoside. What is the base? Either adenine, guanine, thymine, uracil, or cytosine. What is the sugar? If we are talking about RNA, we have ribose. If we have DNA, we have deoxyribose. Okay. Those are the nucleoside. If you add another group, which is phosphate, it will convert it to the nucleotide. So here, the addition of phosphate will converting nucleoside into nucleotide. This is also present in one of the previous exams. Vitreous humor is present in all of us knowing the aqueous humor. Aqueous humor present in the anterior chamber of the eye, and this aqueous humor, when accumulated, it is responsible for the glaucoma. While vitreous humor present in the posterior eye chamber. Okay, it is a clear gel-like substance that fills the space between the lens and the retina in the eye. It helps maintain the shape of the eyeball and provides support to the retina and aids in the transmission of the light to the retina for vision. Okay, this is the vitreous humor. Yes, while aqueous humor secretes from the ciliary muscle, ciliary glands, and it is present in the anterior chamber of the eye, and the accumulation of it will lead to glaucoma, increasing in the intraocular pressure and then glaucoma. In this question, we can differentiate between the potency and efficacy. Let us see this one. MP is a 60-year-old male with hypertension, is to be treated with beta blockers. Okay. Drug X and drug Y have the same mechanism of action. Drug X with a dose of 5 milligram and produce the same magnitude of antihypertensive action. This is an important statement. Same magnitude of antihypertensive action means that they give same efficacy, or EC50 are the same. So when there is different doses giving the same efficacy, this means that the lowest one is more potent. Which is lowest one? Here, 5 milligrams of drug X is equal in efficacy to 500 milligrams of drug Y. Therefore, the drug X is about 100 times more potent than drug Y. The next one. Steady state concentration achieved when? When we achieve the steady state concentration. The meaning of steady state concentration is the concentration achieved when the infusion rate is equal to the clearance rate. It is a situation where the rate of drug administration balance with the rate of drug elimination. And at the steady state concentration, the amount of drug absorbed from the administration is equal to the amount excreted or eliminated from the body. Therefore, the correct statement here is A. The answer A. Okay. Let us see this one. In moderate exercise, take care here, the word is moderate exercise. All happens except increasing cardiac output, increasing TPR. What is the TPR? TPR related to temperature, pulse, and respiration. Decreasing blood flow to the viscera or increasing diastolic pressure. Here we are talking about moderate exercise. You'll find that during moderate exercise, the cardiovascular system undergoes various changes to meet the increased demand for oxygen and nutrients. This change includes the first one, increasing in the cardiac output. So this is right statement. The cardiac output is the amount of blood pumped by the heart per minute and increase during exercise to deliver more oxygen to the working muscles. The second thing, increasing in heart rate. So the palpitation will increase. Increasing in systolic blood pressure. The systolic blood pressure here is the arterial pressure during the heart contraction. It will increase due to the increased cardiac output. Redistribution of blood flow. Another thing happened. The redistribution of the blood flow during the exercise in order to cover the muscles needed. Okay, it will redistribute from non-essential areas such as the viscera to the working muscles to meet their increased demand for oxygen and nutrients. However, diastolic pressure, which represent the pressure in the arteries during the heart relaxation, does not typically increase during moderate exercise. Okay, it may be slightly increased due to the widening of the blood vessels in response to the increased cardiac output. So the correct answer here will be number D. Let us see the next one. Sorbitan monostearate. As a general, when we have a salt of fatty acid, stearate is a stearic acid. It is a fatty acid. The salt of fatty acid, it will be an emulsifying agent. So here we have an emulsifying agent or surfactant. It is a common surfactant used in the production of emulsions, having HLP properties. But this one having a lipophilic character more than hydrophilic character. So it will give water in oil emulsion. Okay, so this emulsifying agent will give a water in oil emulsion. Now let us see the last question that we'll discuss today. Which increases the risk of pyelonephritis? What is the pyelonephritis? It is an infection, mostly caused by organisms like E. coli. It is the infection of the kidney itself. Okay. Among the options listed, diabetes type 2 increase the risk of pyelonephritis. It is a type of urinary tract infection, as I mentioned, involves inflammation and infection of the kidney, while hypertension and hyperlipidemia are medical conditions that can have their own complication. They are not direct risk to the pyelonephritis. However, the type 2 diabetes is known to weaken the immune system and impair the body ability to fight infection, and this make individuals with diabetes more susceptible to various infections, including urinary tract infections and pyelonephritis. Okay, therefore the right answer here will be type 2 diabetes mellitus. This was the last question that we will discuss today. Still, we have another 4 free lectures, plus the complete revision, which form of 4 main revision lectures. The first one will be about the paper 1 revision, contain about 120 questions. The revision 2 will be about paper 2, also contain about 120 questions. The third one containing both questions from both papers, plus some collections, some important collections. And the last one, which is the most important one, will be about the recent or the most recent questions that present in the last KAPS exam. Okay, I hope this one was easy and useful lecture for all of you, giving you an information regarding to the exam and information regarding to the questions present in the exam and helping you to revise some topics. Hope you join our revision, the full revision. You can find the revision in this link. You can join the full revision from this link. Okay, or contacting us to know how can you join from this WhatsApp number. Okay, we will have the first revision tomorrow at the same time, 7 p.m. Sydney time. This will be the first revision for the paper number 1. Okay. Finally, I would like to thank you so much about your attendance and hope to see you tomorrow or in the coming.
Tomorrow.
Yes, please. Yes, please.
This is the first revision for tomorrow is available in the website.
Yes, available in the website. If you are one of the members of our course, the revision will be available in the website in your account. Also, this free one will be available also.
What is the title of that? The first revision like that in the website?
For the revision, it will be under the title of Comprehensive Revision for KAPS exam.
Okay.
Okay, you can find it in our website. Okay. Again, thank you so much and hope to see you tomorrow in the first revision with paper 1. Thank you. Goodbye. Yes. Yes. Do you have a question? You can ask. Yes, please. If you have
Yes, sir. I wanted to know if tomorrow's revision is repeated. It's the same one that's on the website.
No, it will be updated.
Okay.
It will be updated. I'll change the revision that present because it is from the last revision. So a new questions added. Yes, Dr. Mina, please ask.
Hello.
Hello.
If we can't make it for tomorrow's live revision, will it be recorded and updated in the website?
Yes, the record will be uploaded in the website. So if you have no ability to attend, you can see the record after we finish. I will upload the record after we finish.
السلام عليكم دكتور.
عليكم السلام.
دكتور معلش أنا كنت عندي استفسار، عندي كذا حاجة كده واقفة لي صراحة ما قدرت أفهمها، فرسالك على الواتساب ترد علي أحسن ولا أسألك
ما
عليهم؟
فيش مشكلة، لا ممكن تسألي عادي.
أنا كنت عايزة أعرف العلاقة بين الكالسيتونين والباراثايرويد والكالسيوم، تركيز البلاد كالسيوم والكالسيتونين.
كالسيتونين هرمون.
كالسيتونين.
كالسيتونين هرمون ده واحد من الهرمونز السكريتد من الثايرويد جلاند، ليه المقدرة على زيادة الكالسيوم في الدم وترسيبه على العظم. فهو واحد من الأدوية اللي ممكن تستخدم في الأوستيوبوروزيس.
بيزيد تركيز الكالسيوم يعني.
يس.
تمام أوكي.
عشان كده لو في عندك باراثايرويد هرمون elevated أو هايبر باراثايرويدزم، زيادة الكالسيوم بتقلل الباراثايرويد هرمون. فأي حاجة هتزود الكالسيوم هتقلل الباراثايرويد. عشان كده الكالسيوم ممكن يستخدم في الهايبر باراثايرويدزم.
ايوه تمام دكتور، شكرا. وكنت عايزه اعرف الفرق في التريتمنت بين الاوبن انجل جلايكوما والكلوزد انجل
بس
جلايكوما.
مش المهم تعرفي الليست اوف drugs used in glaucoma as a general.
يعني
Okay.
مرات بلاقي دواء بقول لك انه كونتر انديكيتد في الاوبن انجل جلايكوما، لكن انا كنت بستخدمه في الكلوزد انجل جلايكوما.
هتلاقي في الليست موجودة في في الليكتشر بتاعت فيها الجلوكوما. one of the lectures, one of our lectures, there is a list of drugs used in open and closed angle glaucoma.
بس ما في دواء يعني ممكن اي دواء هيشتغل فيهم الاثنين، يعني ما هيكون في دواء بيشتغل في واحدة والثانية.
في حاجات open بس و closed بس.
ايوه اوكي
Excuse me,
تمام
sir.
يا دكتور. خلاص شكرا.
Excuse me, sir.
Yes, please.
One last question. This revision in the website and recalls all are, is that enough for to pass the exam?
Sorry, your voice is not clear enough. So try to.
This revision in the website and all recalls in the website,
Yes.
there are enough to pass the exam if I prepare this properly, all this revision and recall.
Yes, it will help you so much
From the website.
because it contains the revision of or the question of the last July exam, which have the possibility for repetition. Okay, its possibility for repetition is high, so it is a very important revision that you should know it.
ممكن
Yes,
استاذنك، هو
yes.
هيكون موجود على الموقع؟
طبعا الريكورد
طبعا.
هيكون موجود، هنزله على الويب سايت، على الاكونت بتاعك هتلاقيه موجود، هتقدر تفتحه.
طب معلش،
الفيديوز
هو حاجة تانية بس بعيدة شوية. بس أنا غيرت ميعاد الامتحان، وجيبسون ما بعتش تأكيد الميعاد الجديد، بس أنا لما بدخل دلوقتي بلاقي الميعاد الجديد هو اللي موجود.
خلاص يبقى اكيد. اوكي خلاص.
حتى لو ما بعتش ميل عادي يعني.
خلاص ابعت لهم ايميل تاني واسالهم، بس هو كده خلاص. اوكي
تمام. شكرا.
You have any other questions? Okay, about translation, there is no important questions here. Don't worry about the translations. So never mind. Okay. Mostly the link will be the same, but with some differences in the password. So follow the link of the second revision or the free revision, and also I will send it in our groups. And difference between respiratory and metabolic acidosis. Here the difference is related to the main reason. Does it related to the kidney or the blood, or the main reason related to the lung? If the main reason related to the lung, like respiratory depression or increasing breathing rate, so this is a respiratory acidosis or alkalosis. While if the main reason related to the kidney or the blood, it is a metabolic one. What is the order of kinetic in CSS, it's not a clear question. CSS here is a steady state concentration, not related to the first or zero order.
Sir, I have a question. Can I
Yes,
ask?
please. Yes, please.
Yes. So, sir, can you tell me that what is going to be the concentration of calcium in blood in the condition of hyperthyroidism and hyperparathyroidism? Because these two conditions are very much confusing.
The relation between calcium level and hyperparathyroidism or hypoparathyroidism. This is your question, right?
Yes.
Okay. Here we have a direct relationship between parathyroid hormone and calcium level. Okay. Parathyroid hormone affected by the calcium level. Calcium level, when there is a decrease in calcium, it will stimulate parathyroid gland to secrete parathyroid hormone. Okay, so there is a sensor in the parathyroid gland, feels the level of calcium. If level of calcium decreased than the normal, what will happen? Parathyroid gland will secrete parathyroid hormone. In order to do what? Parathyroid hormone having three main functions, like vitamin D, exactly like vitamin D. It will increase calcium absorption from the GIT. It will increase calcium resorption from the kidney tubule. Reabsorption, not resorption, reabsorption from the kidney tubule. Also increase calcium resorption from the bones. Okay. Once the calcium retain its level, the parathyroid gland will stop secretion of parathyroid hormone. So when we have a hyperparathyroidism, what is the treatment of that? The secondary hyperparathyroidism, what is the treatment of that? Anything increasing calcium. This will help me stop the secretion of parathyroid hormone. Is it clear?
Yes, sir.
Excuse me, sir, I have a question.
Yes, please.
Sir, I'm not a part of your course, but today I've joined your revision session because it was shared in one of the groups. So I want to ask that tomorrow and afterwards, if you're giving any like revision sessions, so will they be free or will
No,
it
it will be
only
paid.
be for us?
It will be paid. Belongs to the course. So you can buy it alone without course.
Okay.
Okay, you can buy this revision alone without the course.
Okay.
Okay. Finally, I would like to thank you so much and see you in the coming. If you have any question, you can send it to me in the WhatsApp. Thank you and see you in the coming revision. Goodbye.
Thank you very much.
Thank you.
Bye bye.
ये मैं बोली हूँ वो अनम्यूट हो जाता है या म्यूट होता है?
कौन सी एप्लीकेशन है?